Assalamu alaikum. Bismillahirrahmanirrahim. Now we will discuss about the Pseudomonas. That if we just see its general characteristic, Pseudomonas, a large group of obligate aerobes, a genus of gram-negative, non-spore forming, rod-shaped bacteria. These are the positive on oxidized test and catalyzed test. Motile by polar flagella. Found in water, soil, other moist environment, just like its habitat is water, soil, or other moist environment. Some of them are harmful to plant or pathogenic to plant. If we see its taxonomy, in the taxonomy we have to just remember the three things: family, genus, and species. Family is Pseudomonas dse, genus Pseudomonas, and species Pseudomonas aerogenesia. If we see just its morphology characteristics, they are cylinder, gram negative, their size is 1.5 to 3 microbes, they are monophylegiar, non-capsulated, but many strains have mucoid slime layer. Escape the defense mechanism by loose capsule in which microcolonies of bacillus are enmeshed and protect from host defense. If we go through the species Pseudomonas aerogenesia, the characters for Pseudomonas aerogenesia are they form round colonies with a fluorescent greenish color, sweet odor, and hemolysis. Pyocinin and non-fluorescent. Identification of Pseudoaerogenesa is usually based on oxide test and is colonial morphology, the presence of characteristic pigments and sweet odor, and growth at 42 degrees centigrade. The culture characteristics: growth occurs at wide range of temperatures from temperature 6 to 40 degrees Celsius. They can be grow. The optimum temperature for their growing is 37 degrees C. Growth on ordinary media producing large opaque regular colonies. Iridescent patches with the metallic sheen are seen in cultures on nutrient agar. Biochemical reactions, catalase, oxidase, and arginine test are positive, and the indole test, MR and VP and H2 tests are negative. Laboratory diagnosis: how can we diagnose this? Specimen a sample this from which we can diagnose this: the urine, a pus, blood, septum, swabs, and other the Mekon Kieger. And Mekon Kieger, they appears as a non-lactose fermenter, and the nutrient agar Pseudomonas aeruginosa produce a blue-green pigment and fruity aroma. Milk agar may be added to the nutrient agar to give a white background. Transmit: how to transmit? It transmit its transmission ranges from the urinary tract infection to septicemia, pneumonia, meningitis, and infection of post-surgical and post-traumatic wounds. A common isolate from wounds, burns, and urinary tract infection, and from pus. Also found in otitis, its presence may be indicated by blue or green color of the pus or infected site. Resistance: they are killed at the 55 degrees centigrade in 1 hour. Higher resistance to chemical agent, resistance to quaternary ammonium compound, resistance to hexachlorophene, growth also in antiseptic bottle, sensitive to acid silver salts. What is pathogenicity? P. aeruginosa can affect almost any external site or organ. It produces blue pus, localized and generalized infection, urinary tract infection after catheterization, meningitis, post tracheostomy pulmonary infection. Clinical presentation: this is the disabling eye infection, septicemia, endocarditis, Shanghai fever. What antibiotics to use for the treatment of this? Combined antibiotic therapy is generally required to avoid resistance that develops rapidly when single drugs are employed. Generally we use combination of gentamicin and carbapenem is frequently used to treat severe Pseudomonas infection. Vaccines are being tested. Some are other antibiotics like aminoglycosides, gentamicin, amikacin, and so many. Prevention and control. How can we prevent and control from it? Pseudomonas species normally inhabit soil, water, and vegetation. Can be isolated from the skin, throat, and stool of healthy person. High risk population, patient receiving broad spectrum antibiotics with leukemia, burns, cystic fibrosis, and immunosuppression. Method for control of infection are similar to those for other non nosocomial pathogens. Special attention should be paid to sink, water bath, showers, hot tubs, and other wet areas. This is the whole my group. Thank you for your listening.